What if the technique you've been using for 40 years is now silently working against your health? Most older men never get told how to adapt. They just continue doing what always felt familiar, faster, firmer, focused only on the end goal. But here's the truth. After 60, your body changes. And if you don't change with it, what once brought you comfort can now lead to frustration, discomfort, and even long-term harm. Because the wrong technique, if repeated for years, can damage circulation, reduce nerve sensitivity, and quietly chip away at your confidence more than you realize. That's what we're fixing today. I'm Dr. Nora Hayes. I've been a practicing physician for over 7 years, focusing on men's health, aging, and sexual wellness. And in this video, I'm going to show you how to adapt your self-touch routine so it protects your health, respects your body's changes, and supports your comfort and dignity for years to come. But before we dive in, do me a quick favor. If you're watching right now, hit the like button so more men can find this important information, and drop a comment below letting me know where you're watching from. I love seeing this community stretch across the world. Now let's start with a question many men don't want to ask. Why does self-touch suddenly feel different after 60? So many men come into my office convinced something must be wrong with them because things don't feel the same. They'll say, "Doc, I used to finish in 5 minutes. Now it takes forever." Or "I feel less sensitive. Am I broken? Or even, do I still have a healthy sex drive? Or am I losing it completely?" Here's the myth that aging equals dysfunction. The truth, aging equals adaptation. Your body isn't betraying you, it's simply changing. And what worked at 25 won't necessarily work at 65. That doesn't mean pleasure is gone, it just means the path looks different. And sadly, most men were never taught how to adapt. Instead, they double down. They grip harder, move faster, and push for climax. And all that does is create more tension, irritation, and disappointment. So let's cut through the myths and lay out the science of what's actually happening. Here's what I explain to my patients. After 60, 3 major systems shift. Hormones. Testosterone gradually declines. That doesn't erase desire, but it often makes it less spontaneous. You may not feel those automatic urges you once had, and that's normal. Blood flow. The small vessels that supply the penis become less elastic. Erections may build more slowly or fade if you feel distracted or pressured. Nerve sensitivity. Nerve endings don't fire as quickly. Touch that once sparked instantly may now feel muted or take longer to register. Biologically, that's the landscape. Emotionally, it can feel confusing, like your body has changed the rules without telling you. Practically, it means the old routines
often don't work the way they used to. But here's the encouraging news. With the right adjustments, many men find not only relief, but deeper satisfaction than before. So, let's go through it. The 5 silent mistakes older men make during self-touch, and how to fix each one. Mistake number 1, using the same grip strength you always have. When you were younger, a firm grip may have been fine, but after 60, the skin of the penis is thinner and more sensitive. A too tight grip can damage small blood vessels, reduce blood flow, and actually desensitize nerves over time. Biologically, microtrauma builds up and your body adapts by dulling sensation. Emotionally, this leads men to think they've lost feeling. Practically, over years, you may find it harder to respond to a partner's touch, which can impact confidence. The fix: loosen your grip. Experiment with gentler holds. Focus on sensation, not force. Mistake number 2, going too fast too soon. Your nervous system processes stimulation more slowly as you age. Rapid motion can actually overwhelm the signals, leaving you feeling flat or unsatisfied. Think of it like tuning an old radio. You have to slow down to hear the music clearly. Biologically, slower rhythmic stimulation allows nerves and the brain to catch up. Emotionally, you'll feel more connected to the experience instead of frustrated. Practically build momentum gradually. Don't rush to the finish line. Mistake number 3, skipping lubrication. Too many men think lubricant is optional or only for women, but as testosterone decreases, natural lubrication drops in men too. Combine that with thinner skin and dry stimulation creates friction that can cause micro tears, rashes, or soreness the next day. Biologically, lube protects fragile skin and improves nerve response. Emotionally, it turns discomfort into pleasure. Practically, keep a simple, unscented, water-based
Lube nearby and use it early, not as an afterthought. Mistake number 4, forcing climax. So many men treat climax like a pass or fail test. But after 60, arousal may come in waves. Sometimes climax takes longer. Sometimes it doesn't happen. And that's not a failure. When you push, your body releases stress hormones that actually make climax harder to reach. Biologically, stress hormones compete with arousal signals. Emotionally, pressure leads to disappointment, even shame. Practically redefine success. Satisfaction doesn't have to mean climax every single time. Mistake number 5, ignoring your body's signals. After decades of routine, many men go on autopilot. But at this stage of life, your body's feedback is crucial. If something feels dull, adjust. If something feels uncomfortable, stop. If something feels unexpectedly good, stay with it. Biologically, this keeps nerves and circulation responsive. Emotionally, it builds trust between you and your body. Practically shift from performing to exploring. So, what does a healthier self-touch routine look like after 60? Let me walk you through it. Choose your moment. Don't rush. Give yourself 15 to 20 minutes of privacy. Your nervous system needs calm, not pressure. Set the environment. Soft lighting, comfortable posture, even quiet music can help your brain relax into the experience. Start with breath. 5 deep, slow breaths before touching anything signals to your body, I'm safe, I'm present. Apply lubrication early, not as a tool for finishing, but as part of the beginning. Let it soften and warm the tissue. Explore slowly. Think of it as a massage. Use different pressures, angles, and rhythms. Don't race straight to the most sensitive spot. Pause when needed. If arousal fades, it's okay. Let it return naturally. Stay with your breath. Breath keeps blood flowing, nerves alive, and your mind anchored. Even your position matters. Sitting, hunched forward on a hard chair can compress pelvic nerves. Instead, try reclining, lying on your side, or propping your legs with a pillow. And don't be afraid of using tools and warming sleeves, textured aids. These aren't toys in the childish sense. They're tools, just like reading glasses, designed to support a changing body. Now let's talk about something just as important: when to check in with a doctor. Because while most changes are natural, some are signals your body needs medical attention. Here are 4 clear signs to watch for: persistent pain or burning during or after self-touch. This could signal inflammation or a minor infection, sudden or ongoing numbness. Gradual change is normal. A sharp drop in sensation may mean nerve involvement. Difficulty achieving erections even in private, relaxed settings. That may point to vascular or hormonal issues. Emotional distress. If shame, frustration, or anxiety are overwhelming your experience, it's worth talking through. Talking to a urologist doesn't mean weakness. It means you're invested in your well-being. Even a short visit can give clarity and relief. And remember, you don't need to wait for a crisis. Preventive conversations are part of good health. So, let's bring this together. Self-touch after 60 is not about forcing your body to behave like it did at 25. It's about adapting with respect. It's about loosening your grip, slowing your pace, listening to your body, and letting go of outdated definitions of success. Your body isn't broken, it's evolving. And with the right approach, pleasure can feel not only possible, but more mindful and meaningful than ever before. Remember, Age is not the end of vitality. With small changes, you can reclaim comfort, freedom, and confidence. If this video gave you clarity, give it a like. It helps other men find the answers they deserve. Subscribe if you haven't yet and hit the notification bell so you never miss our conversations here. And before you go, don't stop here. Even with the right technique, there's one silent habit that affects prostate health if you masturbate regularly. Most men don't realize it until it's too late. Click on the video here to learn what daily self-vouch does to your prostate and how to protect yourself for the long run. Stay healthy, stay hopeful. I'm Dr. Nora Hayes, and I'll see you in the next